Welcome to my Lecto. Today we are going to discuss thiazide and thiazide-like diuretic. In this lecture, we will discuss the mechanism of action of thiazide, therapeutic uses of the thiazides and different adverse effect of the thiazides. So, we say that thiazide and thiazide-like diuretics. There is a difference between these two terminologies. Thiazides actually contain a structure which is called benzodiazine, and thiazide like diuretic lack this structure which is the benzodiazine. So on the basis of the difference in this structure, we call thiazide having a structure benzodiazine and thiazide like diuretic having lack of the benzodiazine structure. But their characteristic mechanism of actions and their adverse effects are similar, so we categorize it together like thiazide like diuretics. So thiazides is basically a sulfur derivatives, but it does not cause the hypersensitivity reaction as caused by the sulfur drugs. So this is the basic difference between sulfur drugs and the thiazides. Here you can see that the chlorothiazides and the hydrochlorothiazides, these are basically the thiazides. These are thiazide. And you see indapamide, metolazone and chlorthalidone, these are basically the thiazide-like diuretics. So these are basically the three, the thiazide-like diuretics, and these are basically the thiazides. So we call thiazides low ceiling diuretics. So we call thiazides low ceiling diuretics because, why do we call it low ceiling? Because when we increase the dose of the thiazide, let's suppose here you can see that if we see this one, and if we, here is the dose and here is the effect. If we increase the dose, then effect also increase. But at a certain point, when we further increase the dose, here on the x-axis you see the dose and y-axis effect. At a point reached, when we increase further the dose, then the effect will become constant. It means at a certain point, when we increase the dose, the effect will not further increase. So that's why we call thiazide as low ceiling diuretics. So next we will discuss the mechanism of the thiazides. So thiazides is basically act on the early distal convoluted tubule. So in that situation, you will see thiazides, the action of the thiazides will be on the early distal convoluted tubule. So here you see that this is the endothelium cell of the tubule, and here you see that this is the lumen. This is the lumen. Here you see that inner part of the tubule, and this is the interstitial space, and here you see that this is the blood vessel. This is the blood vessel. So what will happen? Sodium and chloride are basically the two friends, and they come together when they want to decide to go somewhere. Then they will always go together. So here you see that the sodium and the chloride, which are actually present in the lumen tubule, they move inside the cell, in endothelial cell of the tubule together, and this is actually a co-transport. This is actually the sodium chloride co-transporter, which is called the NCC, sodium chloride co-transporter. In that situation, sodium and chloride move inside the cell. So here you see that now the sodium, these two friends now are in the cell. Now in that situation, they will separate. Here you see that the sodium will move in the interstitial space and then finally into the blood vessel. So here you see that first of all sodium move in the interstitial space through the sodium ATP, sodium potassium ATP pump. In that situation sodium move in the interstitial space and from the interstitial space potassium move inside the cell. So this is the ATP pump, sodium potassium pump. In that situation after that the sodium move in the blood vessel. Here sodium will move in the blood vessel and here is the situation. 3 sodium move along with the 2 potassium. So here is the case, 3 sodium and 2 potassium exchange. Actually this potassium come from the blood. So this is actually the whole process. In that situation sodium now in the blood and potassium move in the cell. And this chloride can move. Here is the situation that this chloride can move through the channel into the blood. First it will move into the interstitial space and then into the blood vessel. Next important point is that a receptor which is present in this part, which is the early distal convoluted tubule, there is a receptor and this receptor is for the parathyroid hormone. So here you see that the parathyroid, here is the parathyroid hormone present in the blood. It will move and bind to the receptor. This parathyroid hormone bind to the receptor and increase the absorptions of the calcium from the interstitial from the lumen into the cell. And in that situation this calcium actually exchange. In that situation calcium move inside the blood and along with you will see the sodium exchange along with that. You will see hormone, parathyroid hormone involved in the absorption of the calcium from the lumen in that situation. This is the case. Now this exchanger will activate due to the thiazides. How? So thiazides actually affect the sodium chloride channel. So it will block this channel. In that situation the concentration of the sodium will reduce and chloride will also reduce. In that situation the sodium and the chloride concentration will reduce. If the sodium concentration is reduced in the cell, then what will happen? Then this exchanger will activate due to the low concentration of the sodium. Actually if you see that there is a low concentration of the sodium in the cell, then this channel activate, and due to the thiazide this channel activate, and in that situation sodium move from the blood into the cell along with the calcium exchange move into the blood vessel. So keep remember parathyroid hormone involved in the absorption of the calcium from the lumen into the cell. After that it will involve in the exchange of the sodium and the calcium exchanger. So this is the action for the parathyroid hormone and this is the action for the thiazide. So this is the whole process, but keep remember main action is on the sodium chloride co-transporter, which is the action side of the thiazide. So next we will discuss the note. Important point, you never prescribe thiazides along with the NSAID. So this point is very much important. So NSAID will never be prescribed along with the thiazide. Why? As we know that NSAID block the productions of the prostaglandin. It will block. NSAID actually involved in the blockage of the prostaglandin. If there is you will see that prostaglandin, if there is no prostaglandin, then what will happen? Then the blood pressure or blood flow to the glomerulus will reduce. So in that situation blood flow will also be reduced. Then what will happen? Here you see that if we use NSAID, non-steroid anti-inflammatory drugs. In that situation, this block the prostaglandin, and prostaglandin reduce the flow of the blood into the glomerulus. If there is a reduced flow of the blood into the glomerulus, then what will happen? Then the filtration through the glomerulus will also be reduced. Filtration through the glomerulus will also be reduced, and in that situation, here you will see that there is a low volume of the filtrate and actually thiazides present in this tubule. And working action, at what point thiazide will act? In that situation, you will see thiazides actually act in the tubule. So in that situation, if there is a low amount of the thiazide in the tubule, then the effect of the thiazide will also be reduced. So here you see that this is a tubule, and in that situation, thiazides actually present in this tubule, and it will act at the distal part because these co-transporter actually present at that side. So if there is low amount of thiazides, then it will act slowly, or its effectiveness will reduce due to the low amount. So in that situation, you will never use the NSAID along with the thiazides because it reduces the effectiveness of the thiazides. So this is the most important point. Next, we will discuss the therapeutic uses, how thiazides work. So first of all, it will reduce in the reduction in the hypertension, blood pressure. So it is actually involved in the reductions in the blood pressure. So it acts in two ways. So first one, you will see that here is the two situation. First one is the diuresis. So important thing you have to remember, remember that the blood volume is inversely proportional to the urine volume. Blood volume is inversely proportional to the urine volume. When the blood volume increase, then the urine volume will decrease. But if the blood volume decrease, then what we'll see? Then the urine volume increase. This is the basic process which you have to remember, and this will help you in understanding the different processes. So thiazides actually increase the volume of the urine. So in that situation, if the volume of the urine increase, then what will happen? Then the blood volume will decrease. So in that situation, this is the case when the blood volume decrease, then what will happen? Then automatically the blood pressure will also be reduced due to the reduction of the blood volume. So in that situation, this is the due to the diuretic effect of the thiazides, the blood pressure can be reduced. Second is, it will act peripheral vascular resistance. So in that situation, PVR, peripheral vascular resistance. Thiazides actually involved in the reductions of the resistance. So here you see that you will see the different arteries, and thiazides act on these arteries, blood vessels, and thiazides actually reduce the tension in these arteries. When you see that the tension in the, like you see the example, if you see the example of the hose pipe, then when we compress the pipe or tense the pipe, then automatically the water which will flow through the pipe will increase. So pressure increase in the pipe. When we relax the pipe, normally there is a pipe in the garden and water continuously flow through it. But in that situation, the pressure will be low. So this point is very much important. So you keep also remember that the tension is directly proportional to pressure. So if we increase the tension, the pressure will also be increased. But if we decrease the tension, the pressure will reduce. So thiazides actually reduce the tension. So in that situation, the pressure in the blood vessel will also be reduced. So this is the other effects of the thiazides. Next is the heart failure. In heart failure, we can also use the thiazides, but there is a problem. Here you see, we prefer loop diuretics in the heart failure patient instead of the thiazides. So, because some patients are actually resistant to the loop diuretics. When there is a person who is resistant to the loop diuretic, then what method or what methodology should we adopt? So in that situation, we use thiazides and loop diuretic together. There is a person, and this person is actually the loop diuretic resistance, and in that situation, we give this person thiazides, and after 30 minutes then we give it the loop diuretics. So in that situation, we adopt this methodology in the loop diuretic person. And keep remember, in that situation you have to check the potassium level continuously. We will discuss later in uses of the thiazide. The potassium will reduce in the blood. So in cardiac patients, potassium is very much important in cardiac patients. So in that situation, potassium level should be monitored continuously. Next, we will discuss the hypercalciuria, high level of the calcium in the urine. High level of the calcium in the urine. Those patients who face the kidney. Let's suppose if there is a person, and this person has a problem that this in the urine of this person, you will see the high concentration of the calcium. Then what should we adopt? We give it the thiazide. Why? So in that situation, as we see that the thiazides, due to the thiazide, you will see the increased absorption of the calcium from the tubules into the blood. So in that situation, use thiazides in patient who face hypercalciuria, who have high level of the calcium in the urine. But after the uses of the thiazide, the calcium level will reduce. So in that situation, we can also use the thiazides. Next, we will discuss the diabetes insipidus. In that situation, we can also use the thiazides. So first of all, we will discuss the diabetes insipidus. So in that situation, you will see acting duct. In that situation, you will see the two types of the cells. Here is the you will see the principal cell and intercalated cell. These are basically the two cells which are present in the collecting duct, or you can say late distal convoluted tubule. So in that situation, you will see a gland which is present in our brain, which is the pituitary gland. From the pituitary gland has basically the three portion. From the posterior part of the pituitary gland, you will see a hormone which is called antidiuretic hormone, ADH, or another name for the ADH is the vasopressin. Another vasopressin. This is the other name of this hormone. Antidiuretic means against the diuretic. It actually involved in the reductions of the urine. This is opposite to the thiazide. This is the enemy of thiazide. It works opposite to the thiazide. Thiazide increase the volume of the urine, but ADH involved in the reduction in the volume of the urine. So you will see that it will release in the blood, and here you can see that this is a blood vessel. Here is the blood vessel, and this hormone is present in blood vessels. So this hormone actually act on the receptor which are actually present on the intercalated. This is the intercalated cells. So this hormone will act on the receptor V2 receptor, vasopressin receptor 2. In that situation, if this ADH attached to the receptor, then what will happen? Then at the collecting duct, you will see from in the tubule, the water H2O move from the tubule into the blood. So ultimately, you will see the concentration of the, or you can say the volume of the urine will reduce. So urine volume will reduce in that situation. This is the normal actions of the ADH. But if there is a reduction in ADH, or if there is a effect or V2 receptor is defective, then what will happen? Two situations happen: ADH reduce, or there is a defect in the V2 receptor. Then what will happen? Then the absorptions of the water from the tubule into the blood will reduce, and in that situation the volume of the urine will increase. So in diabetes insipidus, you will see that ADH concentration or V2 receptor will affected. So easy trick to remember, you will remember is by the ADH inversely proportional to the urine volume. Urine volume. In that situation, if you see the increase in the concentration of the ADH, then the urine volume will decrease. And if you see the decrease in the concentration of the ADH, then urine volume will increase. So in diabetes insipidus, you will see that the ADH concentration is low, or you can say the receptor is affected. So in that situation, the volume of the urine will increase. Now, we have to reduce the volume of the urine, because if there is a increase in the volume of the urine and lot of the water excrete from our body, then what will happen? So the patient who face the diabetes insipidus will faces the or fear the lot of thirst. So in that situation, we give the thiazides. This is the very controversial, or you can say very amazing thing, that thiazides can be used for the reduction in the volume of the urine. So how? So in that situation, you see that this is the glomerulus, and in that situation this is the distal convoluted tubule, and in that situation there is a channel. This is a channel which is the sodium chloride channel. Sodium chloride channel. When we use thiazide, then this channel block, and you will see the sodium and the chloride ions in the tubule. The concentration of the sodium and chloride ion increase, and water will prefer to retain with these ions. So actually water is present on the side of the higher concentration of the solute. So in that situation, you will see that the water cannot move inside the blood. Cannot move inside the blood. You will see that sodium and chloride ion in the tubule increase. Water concentration in the tubule will also be. I am talking about tubule. Tubule will also increase. Then what will happen? Then in that situation, the blood volume will reduce. So blood volume will reduce. So if the blood volume is reduced, then what will happen? Then the blood pressure will also be reduced. So in that situation, the blood pressure in the glomerulus will also be reduced, and in that situation, the filtration through the glomerulus will also be reduced if there is a reduction in the pressure. Then in that situation, low filtrate will move from the glomerulus into the Bowman's capsule, which is in the tubule. So in that situation, as we know that if you see my previous lecture, then you see that at the proximal convoluted tubule, you will see the absorption exchange of the sodium from the tubule move into the cell, and in exchange for that, the hydrogen move in the tubule. So in that situation, if the sodium move inside, then the water in that situation in the proximal convoluted tubule, water will also move towards the solute concentration. So this, you have to remember the basic concept that there is a solutes, and you see that the solute and water are basically the two closely friends. When the solute move, then along with that water will also be moved. So you have to remember this. These are basically the two friends and they will always live together. So in that situation, if the sodium ions move, then along with water will also move. So in that situation, further reduction in the volume of the filtrate will you will see. So in that situation, ultimately when this filtrate move, and ultimately you will see the volume of the urine will be reduced in that situation. So this is the case in diabetes in spiders. You will see the increase in the urine volume. But if we use thiazide, then due to the usage of the thiazide, we can reduce the volume of the urine. So next we will see in the urine, by the usage of the thiazide, in the urine, what ions will be increased or what ions will be decreased. So sodium, if we use thiazide, then the sodium ions in the urine, I am talking about in the urine, will increase. As if we block this, then the sodium concentration in the lumen increase, and ultimately sodium in the urine will also be increased. Same here, chloride ions will also be increased, because sodium and the chlorides are basically the two friends. And next is the potassium. So this point is important, how potassium increase in the urine. So in that situation, if we see in that situation, sodium and chloride increase in the tubule. When they move here, this one at the collecting duct, sodium and chloride move inside. These cells are basically the principal cell. I am talking about the principal cell which are present in the collecting duct. Sodium and chloride concentration actually present in the tubule, high concentration. When they move inside, as we see that along with that, you will see the potassium move outside. This is the case. In that situation, if we see that the sodium move through the inside the blood vessel through the sodium potassium pump, potassium move inside. Sodium move into the blood and potassium move from the blood into the cell, and you will see chloride will also move in the blood vessel. So in that situation, sodium and chloride move inside and potassium move outward. So in that situation, lot of potassium move in the tubule, and ultimately the potassium, you will see the potassium concentration will increase in the urine. So that is the case that you will see the increase in the concentration of the potassium in the urine. So it's mean the potassium concentration in the blood will reduce. So next, by the usage of the thiazides, magnesium absorption can also be reduced. So next is the calcium. As we have discussed that by the usage of the thiazide, the calcium absorption will increase and the concentration of the calcium in the urine decrease. So in that situation, calcium concentration in the urine will decrease. And last is the important is the uric acid. Uric acid concentration will decrease in the urine. Why? So it means the secretion of the uric acid will decrease. It means the uric acid concentration in the blood will increase. So how? As we see that in the proximal convoluted tubule, you will see the two excretory system, base excretory system and acid excretory system. Thiazides block the secretion of the uric acid into the tubule. So in that situation, if the uric acid not excrete from the blood into the tubule, then ultimately the volume of the uric acid in the blood increase and the concentration of the uric acid in the urine will decrease. So this is the case why uric acid decrease in the urine and increase in the blood. So next we will see that the adverse effects, hyper and hypo. In what situation you will see the hypo condition. So first of all you will see the hypovolemia. In that situation you will see the reduced in the volume of the blood by the use of thiazide. Blood volume reduced and urine volume increase. Next is the, you can remember it by the Wachmann. You will remember it by the Wachmann. V stand for volemia. Next, K stand for kalemia. So as we have discussed, the potassium, you will see the reduction in the potassium level in the blood. So potassium in the blood will reduce and potassium in the urine will increase. So this is the case. You don't get confused between these two. You have to remember again that here is the blood and here is the urine. So they are basically inversely proportional. In that situation, if the potassium level in the blood reduce, ultimately it means that the potassium level in the urine will increase. So this is the case. So same here, by the usage of the thiazide, blood potassium reduce and urine potassium increase. Next is the magnesium, hypomagnesemia. You will also see that the magnesium in the blood, you will see that the magnesium concentration reduce, and in the urine you will see the magnesium concentration will high. Next is the, if we cut the A, next is the N for natremia, reduction in the sodium level in the blood. So in that situation, as we see that the sodium concentration reduce in the blood, and you will see the sodium concentration will increase in the urine. So in that situation, you will see the hyponatremia. So these are basically the hypo condition. Next we will discuss hyper, means increased concentration. So you will see by the usage of the thiazides, you will see the hyperglycemia. This point is very much important. By the usage of the thiazide, you will see the increase in the amount of the glucose in the blood. Why? As we see that the insulin is important in the reductions of the glucose in the blood. As we know that the insulin produced from the pancreas, so here is the pancreas, from the what cell? Beta cell. Insulin is produced from the beta cell of the pancreas. So as we see by the usage of the thiazide, you will see the decrease in the concentration of the potassium. So in the secretion of insulin, potassium is very much important. So if there is a reduction in the potassium, insulin secretion will be reduced and ultimately the blood glucose level will increase. So this point is very much important. So potassium decrease, it will decrease the secretion. I am talking about secretion. Insulin produced but does not secrete. So in that situation, insulin concentration or secretion will reduce and ultimately you will see the glucose level in the blood will increase. So in diabetic patient, you have to be careful when you prescribe thiazides. So next is the hypercalcemia, high calcium in the blood. So in that situation, you will see that the calcium increase in the blood and calcium reduce in the urine. So this is also opposite case. The uses of the thiazides, as we see that the thiazide increase the absorption of the calcium from the tubule into the blood. So in that situation, calcium increase in the blood. So this is the other case. And last is the hyper. You can also see the hyperuricemia. As we see that the uric acid excretes from the blood into the tubule through the acid excretory system, but thiazide stop this excretory system, so due to which uric acid will remain in the blood. In that situation, uric acid in the blood will increase and uric acid in the urine will decrease. So if the uric acid increase in our blood, then what can happen? So uric acid will start depositing in the joints, especially in the metaphalangeal joints, which is present in the two area. So in that situation, due to the increase in the uric acid, you can see a disease which is called the gout. So you see a disease which is the gout. So these are basically the adverse effect of the thiazides. So this is all about the thiazides. If you have any question, then you may ask in the comment section. Thank you.